I had this one patient who was on our floor. So I was in her room and I was helping to clean up the patient. And as I was cleaning her up, I noticed that she had some like blood clots in her bowel movement. And I asked the patient, if she had any abdominal pain, and she told me that she was feeling some pain. And she, expressed her concerns to me because she told me that she was going to be discharged, that the doctor had just come in to evaluate her and that they were going to send her home. And, she was really concerned and very anxious. And so, I told her, I tried to listen to her, be an active listener, because I could tell that she was really fearful. And I told her I'm going to talk to the nurse and like see if that, I can do in my power. So I left her room and I went out to the nurse's station and I found the nurse and I told her my concerns. I told her that I saw the blood clot, and the nurse tried to reason with me by saying that like her H&H was normal, that the PA had already gone in to assess her that morning. So I told her, I said, the next time we go in, or I asked her if we like, can we go together so that, you could assess her, the so the nurse came into the room with me. When she saw that, she immediately messaged the doctor, and she was not discharged that day. She got to stay another night.
Cool. I really like this story. I feel like you could use it for a couple different things.
So I was with this is like one of my last shifts for I was with a traveler nurse, and one of before we're like giving medications, we're scanning it by the computer, and then one of the medications like fell on the floor, and then he I was the one opening it, and then it fell on the floor, and then my nurse was like, "Oh, just give it anyway." And
Shady.
I was
Shady.
I was I was like taken surprised by it. I was like, there's no way like he's serious. And then but he was serious. And then I went to the charge nurse and I said, we just need to get another one. I didn't really call him out or anything, but I kind of just calmly just handled it and said that we need another medication. It just fell. So I kind of just took the initiative to make that happen since the traveler nurse did not really care. That's kind of I guess a time where I would take initiative for that sense, I guess.
That's a good like integrity one. I like that.
Yeah. Okay.
I
Okay.
like the story just because it shows like that you do the right thing even when no one's watching.
Yeah.
You know what I mean? Even if it
Yeah.
means going against someone who has like more power in the
Yeah.
what do you call it, in the organization than you do. But
Yeah.
yeah.
I had a patient come in, and this was, and he was diagnosed with, and he was ANO times 2, but during one of my check-ins, I noticed that he was harder to arouse and did seem more drowsy. So I asked my preceptor if it was okay if I could get a blood glucose really fast, just to make sure that everything was okay. So I took his blood glucose, and it was a little low. It was at the time. I went to my preceptor. My preceptor told me just to go to alert the attending to have him know and see if there's anything that he would like to give to the patient, because this patient was, or he was at possible risk of aspiration. So we weren't sure if we wanted to try something like that. So we walked up to the attending, and the attending said, okay, I'll put in an order for you. So we walked back and we were checking the orders, because I like, is it bad if he didn't tell us what the order was? He was like, okay, I'll put in the order for you. So then we walked back to the computer and we noticed that he put in an order for a full amp of D50. And upon viewing that order, me and my preceptor both didn't feel comfortable with giving that high of a fix to his blood glucose. And we initially went to the charge nurse and spoke to the charge nurse, as she's a resource, and she also did not feel comfortable with us giving that high of a sugar dose to that patient at the time. So my preceptor then told me to go talk to the doctor and give him an S bar and tell him that I did not feel comfortable with giving this medication. And at first, I was a little bit scared to bring this up to the doctor because I was a student. However, I knew that I would do anything in my power to make sure that my patient's safe, and I would always speak up if I did not feel comfortable with doing something. So I walked up to the attending and I gave him a quick S bar again. I reminded him that his patient's blood glucose was, and I told him that I didn't feel comfortable with giving a full amp of D50 because I believe that this may cause his blood sugar to spike a little bit too much. And the attending thanked me for bringing this up to him, and he also agreed that this wasn't the best possible solution to this patient's blood sugar. And we just ended up collaborating, and I forgot what we ended up giving. I think we ended up giving him like
Half an amp?
D5. I don't know, like something like very like a lot
D5
lower.
you usually do as like a drip. D50, typically they only order half an amp at a time.
Yeah, but he said give a full amp, so we just didn't feel
But like
comfortable
he
giving.
could put the order for half an amp. Like he could change the order amount.
So maybe he did that. I don't remember.
Yeah, unless you like had to go grab and prime a bag of fluids as like a drip through the pump, he probably like made it half an amp instead. And then like was gonna have you circle back and tell him what the blood sugar was after that.
Yeah. So should I use that?
Yeah.
Something up? Because like
Yeah.
it was like uncomfortable at first because it's like a good thing to say that like my preceptor and I talked about it, and then we went to the charge nurse before to
Yeah.
clarify.
I mean, I think as a student that's appropriate. Yeah,
Okay.
like as an experienced nurse, you might say, would it be possible, or do you think it might help to start with half an amp and then I can let you know what their blood sugar is, and they might say, oh yeah, it's totally fine. Or if they feel like they really feel strongly it needs to be a whole amp, then they might say, no, do the whole amp. He needs it.
Had like a nurse in the and she was like being really mean to a PA and like was like, I don't like this PA and all this stuff. And then was like just telling me, it was like the first night with her, and she was just talking about how she doesn't like the PA and the PA is annoying and da 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 da. And then, later I was kind of like, oh, I think she's just trying to help. Like, I think she's just trying to like, build a friendship with you. And like, I don't think, that PA means any harm or anything. And then the nurse, she was like, yeah, you're probably right. Like, I could be nicer. Like, I'm just tired and it's just been hard and I don't want like any more issues like that. So she kind of admitted, and I feel like she kind of softened up on the PA. She never like outright apologized to the PA or anything, but she kind of was like, yeah, like that's a point, and like I could see that. And then I did feel like she, was a bit kinder to that PA. I don't know if that sounds like I
Let's
was
get this
winning.
one.
I didn't want. You like that one?
Because it's basically assessing your ability to, like, when you're faced with a situation where it's like either you kind of blow up your place in the hierarchy or like stay silent, but then the patient takes the fall or somebody else takes the fall because you were too chicken to speak up against someone higher up. It's like assessing your ability to like advocate for that person in a way that isn't like social suicide with your preceptor or your manager or whatever, So yeah, you could say that there was a nurse who's, really great in teaching me, but she was speaking loudly enough for people to hear very badly about a PA.
Yeah, and she was she was telling other nurses too. She was like, I don't like so and so, and da 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 da. And she's annoying, and she doesn't know anything, and XYZ.
So don't mock her voice, but you can say,
Yeah. Oh yeah.
was talking with other nurses at the nursing station in a way where, other nurses, maybe patients, even me as a nursing student could hear, and things that were damaging to the PA's like credibility as a provider, saying, that they're annoying, that they don't know what they're doing. Things that if she really wanted to help the PA, that's not the way to do it. These things were just kind of meant to be hurtful and damaging. When I felt like it was a good time and place to do so, the next time she brought it up, and then say, but what you said was perfect, maybe this, maybe that. And she was like, yeah, okay, fine. And then highlight kind of like the difference, the contrast of like, after that she watched her be nicer to the PA and not publicly say, harmful things about the PA.
Like damaging.
Yeah. And then maybe just talk about how it was a good learning experience of how to, when someone who is more experienced than you is being disrespectful to another provider or to a patient how to advocate for the person who is being talked poorly about,
Mhm.
while still respecting, how much knowledge that person has, whether it's a doctor, or just to make sure that everyone is being treated with respect.
Okay. Yeah. Okay. I like that. Do you want me to like restate
Yeah.
this? Yeah. Okay. Perfect. Yeah. So one time I had a nurse and she was wonderful. I've been following her most of the night and extremely knowledgeable. Um, but at one point, I noticed like really loudly she was talking very poorly about one of the PAs to like the other nurses, and it was where like a lot of other staff members could hear, and a lot of I think patients walking by could hear, and she was talking about kind of damaging that PA's credibility as a care provider and just as a person. And I didn't want to disrespect my nurse, but I just felt like, what she was saying was really hurtful about the PA, and it wasn't, you know, um, helping the PA get better in any way, and it wasn't anything that was, contributing to a positive or healthy workplace. So, whenever it was just me and my nurse at one point, I kind of just, my nurse was telling me about how much she didn't like that PA. I kind of just offered that, I think that the PA was just trying to kind of make friends with my nurse, and that I felt like the PA was well intentioned, and that, I don't think the PA was like, I kind of suggested another point of view with the PA, and that she was really working hard and trying, her best. And she was also new to the team. And I think saying this, my nurse kind of softened up a little bit. And she was like, yeah, you have a point. Like, I don't think that PA means bad. I think I'm just like really tired and I've been here for a while, and it's, tough to have a new person come on and think that they know more. And she kind of just explained her point of view, but she did acknowledge that she could possibly what she was saying was a bit hurtful, and that there was like a nicer way she could have gone about the situation, and she could have talked to the PA herself. And after that, I saw that my nurse was definitely a lot kinder. She didn't speak poorly about that PA at all. She was definitely kinder in her interactions with that PA, and I felt like she had maybe just like a different point of view or a bit more understanding with that PA. And even though that situation was a little bit scary for me, because that nurse, she's very experienced, very intelligent. And I did look up to her. She was 2 years older than me, and I felt like we had like a bond, and I didn't want to break that bond. I felt like it was like important to just point out that like words do hurt, and that there's definitely like a healthier way that that situation could have gone. And I think just like reminding her and giving and just pointing out like a different perspective to my nurse allowed my nurse to just take a step back and kind of realize like her words have an impact, and that there's definitely like a professional way she could go about her thoughts and feelings. And I think it just created better understanding for both sides and was overall a positive experience.
I like that, like her words have an impact. That's my favorite part.
Thank you. I appreciate it. Thank you.
No, I think that's good. Okay, cool. If you find these videos helpful and you want to grab your own list of nursing interview questions, over the years I've collected every question that any new grad has told me they've been asked in their new grad nursing interview, and I've compiled it into a 22-page, 72-question PDF that you can download. It's $5, but with your discount code, you can get it for $3. So your discount code will be just YouTube. So I'll put the link in the description below. Go ahead and check that out if that's something that you think would be helpful. The idea is hopefully you'll encounter any questions that they're likely to ask you to help minimize any surprises during your actual interview.
So a time I had to stand up for myself against a supervisor this was back on the med-surg and tele floor, and I walked onto the unit, and they told me that I was going to be floating to the other unit. And immediately I was just a bit confused because I had floated the 2 shifts prior. So this was my 3rd shift floating. And generally nurses only floated maybe once every few weeks. And I was just really confused. And so I asked the charge nurse who was supervising why I was floating again. And I asked this because not that I was upset or mad about floating, I was just generally curious. I actually liked floating. I viewed it as an opportunity to learn and grow and expand my skill sets and just become more adaptable. And when I asked it though, she immediately just kind of responded back to me in a way that made me feel put down. She said that I was a new nurse and it wasn't in my place to ask questions and just do what I was told because the older nurses had more like superiority. And I was just really taken aback because I was like, whoa, I wasn't even trying to be rude or anything. I was just genuinely curious. And so, how I approached this is I just wanted to really minimize any conflict and nip it in the bud and talk about it right then and there. So, I asked her really politely if she would mind if I could just speak to her in the corner. And although it was, a little nerve wracking to talk to her, I told her that I was just a little upset about what she had said to me and that I just didn't really understand where the harshness was coming from. And I said that I just kind of clarified what I meant by when I asked why I was floating again. I told her that, yeah, I really don't mind to be floating at all. I'm just generally curious because I don't understand how this works. I'm still new to this profession. And she then explained her side and she said that she was sorry and that she just thinks it was a misunderstanding as well. And that she thought that I was coming off or that I was asking because I was mad about it. And so after we both just explained our sides, we then came to a resolve. And she told me that the reason I was floating was because the other unit was extremely short staffed and that they were now going through the floating list again. And it was by seniority on the list. And so since I was newest to the unit, I just had to keep going back. And I was totally fine with that. And so I just told her, thank you for clarifying. And moving forward, I just learned that this is a really great learning experience. It taught me, even when there's an issue, no matter what, if it's with someone that's higher up than you, it's just really important to address it right away and talk it out.
Have you ever been told to sacrifice quality care for efficient care by a supervisor? How did you handle this? Or have you had a disagreement with the supervisor?
Can I have a second to answer that?
Yeah.
Let me think. Thank you. I think it would probably have to do with something about policies and procedures. Sometimes it's a matter of time management. And I've had a management tell me that, okay, we need to kind of pick up the pace or so that you get out of here on time. And so to me, it just kind of felt rushed because I want to always first adhere to the policies and procedures because that shows the best practice, the best evidence practice for the patient's care that's been proven and tried. So I don't want to have to rush through something because of time constraints. And so just learning how to be more proficient time-wise and managing my time to get tasks done, I had to kind of implement a plan to do that. Maybe if it meant me like just being prepared in advance. I think that was mainly it. There was that disagreement about just trying to get through stuff so that you can clock out on time. So I think that, I don't know if that answered your question or not. I think
we can work with that.
Okay.
Keep thinking if you think of something later that we could use for this. I would frame it as like that time management is something that like, I guess say it in a way where it seems like you don't have a problem with time management, like that it's something that you have worked on and made a lot of progress on over the years and you feel comfortable with it now. But there was an occasion where multiple things needed to happen right at shift change and you wanted to follow policy and do what was best for the patients. And like maybe there was a concern about like they didn't, whatever it was that like they wanted you to get out on time. And yeah, like make it sound, because when you said it, I'm kind of thinking like, oh, is this like a pattern for her where maybe she doesn't manage her time, or like, is she telling me that like she's always staying over? And as a manager, like they tend to be kind of conscious about budgets. And so they're
Mhm.
like, maybe she's really expensive if she's always staying over. Um, that's kind of like
Yeah.
the red flag that pops up with that answer. I think you can like
Okay.
tweak it a little bit to work with it. I don't
I
think you have
gave
to
you a red
scrap it
flag.
completely.
I think the better one would be that, so since then, since I having that conversation with my management, what I did was I did see that some things were taking me a little bit more time to accomplish because the time involved of certain procedures or tasks. So what I did was I would come in early, at least 20 minutes early. I would gather all my patients' information and data. I would put it down on my worksheet, on my to make sure that I know which things to approach first. And I think that kind of helped me with my time management, just being prepared in advance. Although this was time that I came in on my own, it wasn't against the company, just so that I'm more prepared and I can set aside my priorities, like what things need to be done first. So that approach has worked for me. It helped with my time management. I'm able to go in and tackle things that need to be done. And I'm now learning how to get I've been able to get out on time.
I like that you said you've been able to get out on time. Maybe another idea
Okay.
you could work in is like maybe it was a bunch of things happening right at shift change, and maybe you learned that it works better if like when you do have downtime where your patients don't need anything, to make sure like you've gotten all the other responsibilities done that you can do.
Oops.
Like, making sure you've done all your charting and you've given any meds that can be given, or done any dressing changes and not leave them just in case something comes up, so that you can like still get out on time even if something unexpected happens. Because then it kind of makes it sound like it wasn't your fault. Like everyone has had that like random stuff that happens right at shift change, maybe.
Sure.
I
That
don't know.
makes sense.
Just an idea.
Okay.
Yeah.
I'll take it. That
Yeah.
makes sense. Yeah. Thank you.
Yeah.
Good feedback.
Yeah, right. It's like you get an admission, someone else needs to be discharged, and like somebody else
Oh God.
starts pooping blood, and you're like, God, I can't be in 3 places at once right now. What am I supposed to do? And you stay over.
Yeah.
It's
So yeah, I agree. So it's kind of like, in situations like that, these are real situations that have happened. Like at the beginning of shift, I'm already being told that there's a discharge, and I've gotten a report, and I see that some of the patients may need fluid replacement, and I'm getting an admit in the next 30 minutes. So, and I'm still trying to get reports. So I would ask out to the break nurse and see, hey, maybe can you help with the discharge, so that I'm making room in my schedule to handle the admission that's coming in, because I want to be the first one that lay eyes on this patient and gather the information. So and then, yeah.
Yeah, I like that. That works. No red flags
Yeah,
like
those
that.
are real situations.
Yeah. Okay. Have you ever been told to sacrifice quality care for efficient care by a supervisor?
I haven't had this happen to me before, but if I were to have a manager ask me to sacrifice the quality of care for efficient care, I would probably sacrificing quality of care goes against my beliefs as like would go against my personal beliefs as a nurse, because I was taught that we have to give quality care no matter what, whether if we're understaffed. Like us as nurses have a duty to provide the best care possible to every single patient.
So
I haven't had that happen to me before, but like if that's what I would say. Like I don't think personally, I don't know, think like as nurses we should sacrifice quality care ever.
So you got the first part of the answer like spot on. The second half that they would be waiting for is because you like to learn as much as you can. You always see it as a great opportunity when someone with experience like wants to share that experience with you. And you would love to hear any strategies that they have for how to make your care more efficient, because if your care is more efficient, it's going to improve the quality of care overall for all of your patients, especially in times where you may be short-staffed, but you absolutely would not do anything that would harm the quality of care for your patients. But you definitely would love to learn about how to be more efficient, because it'll help the quality of care, which is always going to be the goal.
So that second part, I would say, I would ask my manager how I could make my care more efficient, but as well as not sacrificing the quality.
Yeah, so you could say, like, I guess for like a flow of it, you could say, the most important thing for me is to always provide the best quality care that I can. But because I love to learn as much as I can, especially from people with more experience who are willing to share that with me, I would love to strategize with them and see what ideas they might have for how to have more efficient care, because if I'm more efficient, it'll help the quality of my care overall. And having quality care is always going to be the most important goal for me.
Okay.
Yeah. I have something for all of you that I'm very excited to finally tell you about. It's something that I've been working on for over a year. And this is great for nursing students who are just starting out. This is also great for the person who has an interview in a few days and is trying to put all of the pieces together so that they can be organized and confident going into their interview. And it is my solution to what I hear from all of these nurses that you see in these videos. They all tell me, I know something like that happened, but I can't remember it now and I wish I'd written it down. I know a lot of clinical instructors and nursing professors encourage people to write down their clinical experiences so that you can remember them later, especially when you're in front of a hiring manager interviewing for your dream job and it's something that happened, months or even years ago, and you want to be able to articulate it well. It can be so valuable to have everything written down. So I've made it's a hybrid between a clinical journal so that you can save all of your memories from clinicals, but it's also divided up by question. So for example, let's say you had your first rapid response that day, you would flip to the question section that says, tell me about your most critical patient. Write down everything that you can remember, while you're waiting for post-conference or whatever it is, whenever you have a few minutes. And then when you finally get that call out of nowhere asking if you would be open to coming in for an interview for your dream job that's in 2 days, you have everything organized. And then it's also a nice thing to have looking back, remembering all your first patients and the first time that you did all these different skills that you're learning. So I've tried to make it all cute and aesthetic for you guys. It also includes why they ask certain questions, what they're looking for, do's and don'ts for answering questions, and then it has clickable QR codes so that you can watch examples of how other people have put their answers together who've been successful in getting the job that they wanted through their interview style. So it is about 250 pages. It's also meant to be sort of a how-to DIY version of the online one-on-one coaching for situations where you may not necessarily want to hire a coach for your answers. It is a fillable PDF. It also has other sections like, frequently asked questions, things like what should I wear? What do I do if I'm nervous? What should I put in my portfolio? I could talk on and on about this thing. I've worked on this, like I said, for over a year. I'm really excited about it. It's finally available. I do have a discount code for supporters of the channel, currently for 50% off if you use your discount code.